The health sector, in a heartfelt appeal for improved working conditions, the National Association of Nigerian Nurses and Midwives Federal Capital Territory Council has issued a 15-day ultimatum to the FCT administration. The notice dated September 15, 2025 is demanding urgent action on pressing welfare concerns with a potential 7-day warning strike if its demands are unmet by midnight of October 2nd, 2025. This development signals a critical moment for FCT's healthcare system, which many believe will place a strain on the healthcare needs of residents. Some of the demands include the urgent recruitment of over 5,000 nurses to meet the World Health Organization standards, 1 nurse per 4 patients, the immediate provision of equipment and consumables to ensure safe, effective care, the full payment of 13 months hazard allowance arrears, amongst others. And to further discuss this, I'm joined by our correspondent, Aisha Saliu. Aisha, what has been the immediate response from the FCT administration, if any, since the ultimatum was issued? Are there any signs of negotiation or engagement with the nurses' union?
FCT is just escalating, and it's even in a very precarious state at the moment. You'd recall just a few days ago, the resident doctors in the FCT equally embarked on an indefinite strike, which put a lot of strain on the rest of the healthcare workers, particularly the nurses. And now the nurses have issued a 15-day ultimatum to the Federal Capital Territory Administration, issuing out a number of concerns and demands, and saying that once the night of October 2nd, once their demands are not met or there is nothing coming new, then they would embark on a 7-day warning strike. And I heard from the leadership of the Nursing Association in the FCT earlier today, and he did mention that the FCTA, since they issued that letter and the day is counting already, there hasn't been any form of contact from them to call them to see what they can do. But for now, there is no such contact at the moment, no new development regarding that. But right now, it just means that the healthcare sector in the FCT is still facing a lot of challenges, since the doctors have down tools, and now the nurses who are already overworked and overstretched, and with a few number of personnel on ground, it just means the situation is escalating.
So, Aisha, I mean, it's interesting to see that the nurses are taking a stance on this, but with the demand for a recruitment of 5,000 nurses to meet the global standard, how realistic would you say that this is, considering that they have a 15-day ultimatum, and even the payment of the arrears, but especially hiring 5,000 new persons in less than 15 days? Is this realistic at all?
Well, I'm not sure how realistic that can be, but then when you speak with these health officials, they would mention that there are many healthcare professionals who are waiting. I mean, and once the government declares a state of emergency on that particular sector, it's not like there are people who are not available to be employed. It's more of the will of the government to say, okay, we're taking this action today and we're doing that. The nurses are complaining. They're saying they're overstretched. They're working more, and this has also given back to the Japa syndrome, where some healthcare professionals are traveling abroad, and apart from the workforce, they're also asking for infrastructure, amongst other things. So I don't know how realistic that can be, but then officials and healthcare professionals are saying that there are lots of healthcare professionals available even in the FCT, and once the FCT declares a state of emergency today, they would get those people on board, and then also their welfare catered for.
Aisha Saliu, thank you for the update on that, and we'll see how the government responds to this. It's a very critical need of the health sector, and we're hoping that there is a resolution in no time.